Hello everyone, this is Dr. Naz and today I'll be discussing about patent ductus arteriosus. Ductus arteriosus is a structure which communicates the aorta with the pulmonary artery because the lungs are not yet functional and the mother is providing the oxygenated blood to the baby and the baby needs to circulate that oxygenated blood, so the blood from pulmonary artery goes directly to aorta with this communication and then to the rest of the body. So it arises at the arch of aorta after the branches that goes to the upper extremities and brain. So what happens in patent ductus arteriosus? Usually it closes soon after the birth, but in some people, in some neonates, this communication remains patent and it remains open after the birth, and it results in left to right shunt since the pressure in the aorta is higher than that in the pulmonary artery. So prenatally, the ductus arteriosus is the vital structure. It allows blood from the pulmonary artery directly into the aorta bypassing the lungs, and it remains open prenatally because of the prostaglandin which is produced by the placenta and ductus arteriosus itself. Ductus arteriosus closes after birth and becomes a ligament which is known as ligamentum arteriosum by 3 weeks of life. The closure is triggered by the postnatal partial pressure of oxygen which is increased due to breathing of the newborn. Also, the decrease in prostaglandin causes ductus arteriosus closure, and bradykinin which is produced from the lungs also helps in the closure of smooth muscles of ductus arteriosus. So these are some factors which helps in the closure of ductus arteriosus after the birth of the baby. Patent ductus arteriosus is associated with prematurity and congenital rubella infection. 90% cases of patent ductus arteriosus are isolated cases, whereas 10% are associated with rubella infection. Initially, patent ductus arteriosus causes left to right shunt, resulting in pulmonary hypertension because of excess blood flow in the pulmonary circulation, and it results in late cyanosis. However, later on, the shunt reversal occurs, that is, it results in right to left shunt because of the increased pressure of pulmonary circulation, and it will lead to Eisenmenger syndrome. The patient may also present with differential cyanosis, which means there will be cyanosis of the lower extremity because desaturated blood from the ductus enters the aorta distal to the left subclavian artery, sparing the brachiocephalic circulation. So the patient will have normal to pink upper extremities, whereas blue lower extremities. The patient presents with continuous machinery murmur in both systolic and diastolic phases of the cardiac cycle. It is also known as Gibson's murmur, and it is best heard in the pulmonary area, which is second intercostal space on the left side below the clavicle. The treatment options of patent ductus arteriosus include pharmacological closure and surgical correction with surgical ligation. So the pharmacological agents include prostaglandin synthase inhibitor, also known as NSAIDs, that is non-steroidal anti-inflammatory drugs like indomethacin or ibuprofen. They are used in the first week of life and the ductus is structurally intact. Surgical ligation is indicated in the absence of pulmonary hypertension, and the surgery is contraindicated in the presence of pulmonary hypertension and Eisenmenger syndrome. In certain diseases like transposition of great arteries, we need to require the ductus arteriosus to remain open because the survival depends on it. So what is transposition of great arteries? In which the aorta arises from the right ventricle, whereas the pulmonary artery arises from the left ventricle, and it results in the separation of systemic and pulmonary circulation, and it is incompatible with life. It is the most common cyanotic lesion, and it presents in the immediate newborn period, and the postnatal survival requires mixing of blood by either a VSD or ASD or patent ductus arteriosus. So that's the end. I hope you learned something from it. If you do, please like my video and subscribe to my YouTube channel. Thank you so much for watching.